And start. Good evening, everyone. Welcome from India Vision Institute, and thank you all for joining the fourth talk of Excellence in Vision Science, a monthly lecture series that presents the research work by experts in optometry and vision science. The month is there is a focus on glaucoma. We had the World Glaucoma Week celebrated last week. So there is a huge focus on glaucoma education and awareness this month. So today's topic is on dimensions of research in glaucoma and optometrist perspective. And very happy to introduce our speaker, Dr. Ashima Ashokan. She is currently the professor at Elite School of Optometry and leads the occupational optometry services of Shankar Nethralaya. She is involved in clinical research in glaucoma. She, along with her study team, has published several works in national and international peer-reviewed journals and currently holds more than 30 peer-reviewed publications. She also is a reviewer for several international journals. She is presented at various national and international conferences and has received several awards. To name a few, Young Scientist Award, Golden Jubilee Award from the Indian Association of Occupational Health, and Best Case Report Award from the Optometry Council of India. She is also a proud recipient of Endeavour Executive Fellowship from Australia and a competitive grant from the Glaucoma Foundation, US. Her area of research includes environmental effects on the eye, glaucoma, occupational ocular disorders, and innovative educational models in optometry. Thank you so much for joining us today. And before we start, any questions to Dr. Ashima can be posted here in the chat box or the Q&A section here. And this session is also live streamed in Facebook. So audience who are viewing this through the Facebook platform, please feel free to post your questions in the comment section, and I'll take it to Dr. Ashima. And thank you so much. Thank you so much, Dr. Ashima, again for joining us today. And we'll hear from you on the research works from. Over to you, Dr. Ashima.
Thank you, Kalpa. Thank you so much for inviting me. That too, especially for the month which is dedicated for glaucoma awareness. And I'm very happy and proud to be a part of this IVA's Excellence in Vision Science Research series. And thank you for inviting me. So today's session is, I'm going to share my experience in glaucoma research and how I got into research and how the papers actually came into the stream of glaucoma. And when Kalpa asked me about what are you going to talk, then she said it should be on research and glaucoma. Then I said, okay, as an optometrist, how we see glaucoma research and what are its dimensions and how people perceive glaucoma research. Because whenever we say about glaucoma, it's the ophthalmologist purview, right? It doesn't come into optometrist perspective at all. So I thought I being in glaucoma research for a long time, I thought I should also tell people that optometrists can be involved in glaucoma research and clinical practice and how the clinical practice can be transformed into research. So I thought I will just utilize this 30 minutes to share my experience as a researcher in glaucoma. And you can ask many questions because this talk is going to be a very short talk, but I will open the forum for discussion so that we can have more of interactions. So I'll share my slides here. Is the slides moving, Kalpa?
Yes.
Okay. So today I'm going to talk on dimensions of research in glaucoma as an optometrist perspective. First of all, when we talk on glaucoma, it is the optic nerve pathology, right? So it has both structural and functional damage. So it has a characteristic visual field defect, right? So when I talk about this, we as an optometrist become the frontline person in diagnosing this condition, right? So because we are going to see the patient, we are going to measure their intraocular pressures, we are going to see the anterior segment, we will be able to do the visual field testing and look at their functional loss. So we are involved in all the aspects of diagnosing the glaucoma. So definitely we are the prime person in co-managing the condition called glaucoma, which is a blinding disease. So when you look at the eye care professionals, ophthalmologists to optometrists, the ratio is very less. And which means that when you want to tackle a condition which is blinding, you need to have hand in hand. You have to go with the ophthalmologist and screen for these diseases, make sure that your contribution for disease diagnosis is going to be more, especially in the blinding disease such as glaucoma and diabetic retinopathy. So there are studies which have said that there is good accuracy of optometrist diagnosing the condition of glaucoma. So which means that we are trained in diagnosing the conditions. I'm not talking about the management aspect at all here. We're talking about the diagnostic aspects of glaucoma, where we can actually pick up the condition very early. So we have to be properly trained in visual field interpretation, and decisions like medical and surgical management, like this is mainly for people who are in independent practice, how and when to refer the patients with a suspect of glaucoma, or patients who are on treatment for glaucoma, when you have to refer to the ophthalmologist and things, and when to have the visual fields test done. So these are the things where the knowledge level has to be improved. So as an optometrist, we are playing a prime role in diagnostics, where the knowledge and skill is very important, referral and co-management, where appropriate care to the patient is important, and we are also involved in the diagnostics. Coming to research, it is important because we have to practice the evidence-based practice, right? Now everywhere it is the EBM, the evidence-based medicine is coming up. So we need to know what is the current update in glaucoma, and we should be following that. We cannot be going with the old book of thoughts, right? So we need to have a balance of both knowledge and skill. You should know about the disease process. You should know about the referral guidelines. What is the current research? What are the updates on referral guidelines? How do we diagnose and co-management condition? This is very important. This comes only with not just reading the textbooks, because textbooks are almost 5 years outdated. So it means that we need to be updated with the more of reading of recent publications. So what is the aim of assessing a patient? So we need to know whether the person has a glaucoma or not. And will glaucoma happen in future? Whether the person is at risk for the glaucoma, you should be knowing what are the risk factors, what are the other differential diagnosis, what is the mechanism of damage, and what is the plan of management, and what is the treatment modality. So why am I talking all these things when I'm focusing on research? All these questions can be answered with the research. So whether you're an independent practitioner, whether you're going to be attached with a hospital, or you're into a complete research, all these questions can be answered with a simple questions. So you need to know whether the glaucoma is present or not. How do we identify? So you can actually look into the diagnostic tools and do some research with that. Who's at risk? Who's at having a disease? Whether the person will have a disease in future or not. So diagnostic accuracy. So something like modeling, that is also a research, a risk factor assessment. That is, you can do a cross-sectional research or a cohort study and assess the risk factors for glaucoma and present it, right? So all these factors actually, can relate to our research, and we can start working on these questions, right? So we are actually diagnosing a condition, and at the same time, we are actually doing some research on it, right? So a strength of evidence, this is a very famous slide when people talk about research. The strength of evidence goes up with the pyramid, right? So it starts with case reports, case control cohort, and then comes the systematic review and meta-analysis. So this is a pyramid where the case reports and case studies have a lower evidence when compared to the meta-analysis or the randomized control trials. Okay. Has somebody raised a question? Am I audible, Kalpa?
Yes, Rashma.
Okay, somebody raised hand, so I thought, should I stop here? Okay.
No.
Right. So there is this slide is a very famous slide, the glaucoma continuum, where it explains about how the glaucoma happens and how it actually leads to blindness, right? So it starts with apoptosis, that is cell death, and goes with undetectable changes, and then it comes to a structural damage, and then you see a functional loss. All these changes did not come with just one drawing, okay? All this had actually come from a cumulative data from research from all these studies. They're listed down. The yellow color here are the studies which had actually been very famous study groups of research in glaucoma. That is ocular hypertension treatment study, or the advanced glaucoma intervention studies, the early management glaucoma trials. All these things are the trials which are focusing mainly on glaucoma. They're not doing any other research. They are actually focusing on glaucoma and progression in glaucoma. What happens for person who do not have a disease? When do the person gets the disease? Person with a high blood intraocular pressure, when the person actually progress to a glaucoma? All the questions which I had listed down in the assessment is actually being worked out by these glaucoma research group, and they have come out with this specific glaucoma continuum. Now, coming to research. So when research is broadly classified as primary and secondary research. Primary research is like you start everything from scratch and you take it up. Secondary research, somebody has done a research and you're going to review with the research, okay? In primary research, it is further divided into basic research, clinical trials, epidemiological trials, and secondary is further divided into reviews and meta-analysis. Let's not focus about secondary now. Let's focus into the primary research. Whenever people talk about basic research, they think that it's only the hardcore science research, which is the biochemistry, genetics, microbiology, and pathology. Not only that, including your idea like protocol development or a product development, your idea concept making, all that also comes into a basic research, okay? So that comes as a theoretical research. Applied research is what the genetics, biochemistry, or any cell studies or animal studies comes into the applied research. And in clinical trials, you have experimental clinical trials and observational clinical trials. So experimental clinical trials is where you have the phase 1, phase 2, phase 3, phase 4. And observational is where you do some intervention and waiting for the results, okay? It can be a therapy, it can be a diagnostic study, it can be data analysis, it can even be case series of like few patients where you tried something new and observing that and writing that, okay? That also can come into clinical trials. Epidemiological trials are further divided into experimental and observational. In experimental, you have interventional, which is like you do, you take a group of people and then you follow them up and see what is happening with them. And in the observational, it is like take a group of people who have the disease, group of people who do not have the disease, and follow them up. That is cohort study. And your case control is have a disease, do not have a disease, and go back retrospectively and analyze the risk factors. Cross-sectional is a snapshot at one point in time. So likewise, all the group of population-based research comes into the epidemiological trials. So this is a basic structure of medical research. Now I'm going to club this as BCES, where B is basic research, C is clinical trials, E is epidemiological, and S is the secondary research. So BCES is a major the research group. So I'm going to start like how I got into glaucoma. So when I was in my third year of BS optometry, I had a project topic which was in visual fields, and I had to do in the glaucoma department. So under the supervision of Dr. Ronnie George and Dr. Ramesh. So that's when I started my interest into glaucoma. So from there, I started my master's. Master's was also in the glaucoma team. And then I went into PhD. PhD was also with the glaucoma research team, but my PhD was not into glaucoma. That was into environmental science. That is UV and I. So still, I was working in a group called the the Chennai Glaucoma Study Team, where they were actually exclusively working on glaucoma research. So I was working with the glaucoma research team where they were doing an epidemiological study. So I started with some data collection in my third year, which is into glaucoma with the same team. So I started my from BS Optometry, Masters and PhD was into the same group of Chennai glaucoma study. So that's where my interest towards epidemiological studies uh, turned into my PhD career. Okay. So E is where I started. But you can ask me whether, did you focus into other four? Yes, I'll tell you how. So into basic research. Okay, so I said theoretical questions, like something very fundamental question also comes into a theoretical research. So there was one question which we wanted to answer. Is there any difference in corneal thickness between urban and rural population? This is just a snapshot. We thought whether this idea is right or wrong. Why should a corneal thickness be different between two different populations? So we thought, let's explore this. Then we already had a data with us. So we explored, looked into the difference, and yes, it exists. There was a difference between the corneal thickness between the rural and the urban people. So because why did this come? This was just a question which was discussed during one of our meetings. Like we see the rural people having a cornea which is thinner when compared to the urban people. So we thought, let's explore that. And we got an answer, yes, it is true. There is a difference which is existing. And we also looked into the applied science. We actually, this is not my own study, okay? So this is where I was a part of the study group. I got into the publications. So I got into genetics. There was a team from genetics team, they came in and said they want to look into the genetic related to glaucoma, that specifically on primary open angle glaucoma with the Indian population. So we already had the team of Chennai glaucoma study team collecting blood samples for genetic analysis. So that's when I got into the genetics, right? But I had no idea about the basics of genetics at all. Here, my work was giving them a clinical data. So the identified patients, what was their clinical portfolio? That was the sharing between the genetics team and our team. So that's when our relationship with the genetics started working on. So being in a tertiary eye care hospital with a vision science group into the hospital, we had an advantage of having a collaborative research within the hospital sector. This was first of that collaborative research for my side. And looking at the trials, so if you look at glaucoma trials, it will mainly be, they give a glaucoma drug to group A, another group B, and see whether the new drug is effective or not. I was not involved in those kind of research studies. Probably was supervising a few of the projects, but not directly involved into the studies. So whenever you look into glaucoma, the first and foremost outcome measure is the intraocular pressure, and then would be the change in the visual fields or change in structural damage. Either you look into the OCT changes or you look into the visual field changes. So this is what we were focusing on in the clinical trials. Yes, as an optometrist, we are involved in these kind of research, right? So we also had a question whether there are change in corneal properties and its effect on intraocular pressure measurements following a cataract surgery. Because when patients get into cataract surgery, there is an IOP lowering which is happening, right? So we wanted to know what kind of corneal biomechanical properties actually has this kind of change. So this is one of the trial which we did. So we are not actually giving them any drug, but the intervention over here is only the cataract surgery. So we had people who had cataract surgery and looked at their intraocular pressure drop, or how was intraocular pressure pre and post cataract surgery, and with and without trabeculectomy, right? So we had two different group of people, one with the trabeculectomy, another without the trabeculectomy, and looked at whether their corneal biomechanical properties changed or not. So this was one of the study which we had worked on. So the next is, so we completed B and we completed C, and next is E, the epidemiological study. So I was a part of the epidemiological study. From that study group, I should say I had more than 30, 40 publications out of the study group. So I'm going to give a brief about one or two studies, okay? So an intervention here is, so epidemiological study, we had interventional group and observational group. So one interventional example which I wanted to give you here is the prophylactic laser PI. So whenever people had seen a patients with primary angle closure suspect, there is a debate whether to do a PI or not. Okay, not all the consultants do a PI. Sometimes they say that, oh, let's have a close watch with the patient, not do the immediate PI, right? So we had a group of people who had a PI and a group of people who did not have PI. And we did a comparison looking at how the cataract has progressed. And to our surprise, the people who had PI actually progressed faster when compared to the people who did not have PI. All these, I'm not discussing much about the study methods because we had a good number of inclusion exclusion criteria for this particular study. Okay, and which means if you do a PI as a prophylactic measure for PACS, there is a chance that the patient cataract status would progress because of the laser energy which has been absorbed by the lens, and this patient is going to go in for cataract surgery at an early stage. Okay, so you are doing a harm to the eye. Okay, instead, if you could have a follow-up where, if it is possible, have a follow-up so that you're actually arresting the progression of cataract and also making sure that the person is not turning into PAC or PACG. Okay, so he's only a suspect. So I'm not taking a call on whether PACG or PAC to do a PI or not. It is actually for the suspects. Okay. So another study was an observation. I'm going to talk about 6-year incidence and baseline risk factor for pseudo exfoliations on Indian population. Okay, we saw an interesting group of people who had pseudo exfoliation. So we are looking at what were the risk factors for pseudo exfoliation after 6 years, whether these patients turn into glaucoma or not. So these were some of the questions which we had, because the Chennai glaucoma study had two study arms, like one was urban and rural, and the other is like after 6 years we followed up these patients and looked at the risk factors also. So it was not only a cross-sectional study, it also had a cohort study. Okay, so we looked into a progression of pseudo exfoliation. This particular paper actually is a breakthrough in my research career because it actually paved way for international grants. Okay, I applied for international grants and got the grant also. Maybe I'll discuss that a little later. So we finished B, C, E. Next comes the secondary research, that is the review. So we also had chance of writing review articles in good journals. So we had 1 or 2 review articles which has been written up, and we also had chance to write a book review, book chapters based on multiple reviews. Okay, so these chances all came in because we had some publications, quite a good number of publications from the epidemiological study and also from the clinical studies and also from the basic research team. So we had invitations to write reviews. So this happened. I, being an optometrist, not only being in the research, the Chennai glaucoma study, had an interest towards research and had questions which were asked during discussions. We had chance to supervise the students. So we had a lot of questions running in our mind, so which we had discussed and started writing the papers. This is all about being in the research arm, the research wing of Shankar Netrali, the Chennai glaucoma study, and how the papers got into the BCES, right? Another the project which was parallelly running was an idea which came into a research project. Okay, so eye tracking technology was coming up in the research. It was a very trending topic. So what we thought is there was a group of people in Netherlands who were working on eye tracking. So they had we had met them during a conference and we had exchanged ideas and thought, why not we collaboratively work on eye tracking technology in glaucoma, right? So that is how we thought, okay, let's have an idea. So a person has to move their eyes whenever they see a stimulus. If the stimulus is in the non-seeing area, the patient has a scotoma, then if the stimulus is seen there, the patient is not going to move the eyes, right? So this idea was captured and we thought, instead of the regular visual field, that Humphrey visual field, if we do this eye tracking technology and see whether the person's reaction time, and also the person's response to the stimulus. Okay, like the response is not the pressing the button, it's only the movement of the eye. With that, we thought, why not we come out with a new perimetry technique. Okay, so that's how the eye tracking technology in glaucoma diagnostics as an idea came out. And we started with the eye tracking tool where this is completely a collaborative work with the Rotterdam University, Erasmus MC in Netherlands. Okay, so we had master students. I think we had about one, two, three, three or four master students working on this particular topic and coming out with an excellent papers from this idea of eye tracking and glaucoma. So the first step was to prove that is this idea is possible. So there is difference between normal and glaucoma. If there is no difference, then this idea cannot go up, right? So we started with the first step as this saccadic reaction time between normals and glaucoma was different. Then we thought, yes, it is different. This was the first step. And then we moved on. We moved on plotting the sectors, okay? How the visual field plots has to be done and compared between the standard optometric perimetry and the eye movement perimetry. And this was a comparison, okay? And next is like, people are more fascinated, and we have been using the Humphrey perimetry for years, right? So we have that as a mindset, right? So we need to have a comparison with that. And the mirror comparison, the glaucoma hemifield test, the same thing. We had also looked into the hemifield comparison saccadic reaction time, and that was also plotted. And whether this can be used as a screening or not, because if you look into the diagnostic test, it takes a long time, right? So we need to know whether it can be used in screening or not. So we also reduced some points, experimented, and then designed this protocol and looked at it. And yes, it was also being a very good tool. So if you look at screening for glaucoma with visual fields, we already had frequency doubling perimetry. So thought it should be compared with frequency doubling perimetry, and we did a comparative study, and that was also published, right? Okay. With all these things, the eye movement was actually coming up with its diagnostic capacity in glaucoma. And not only that, this is a recent research which is happening in the department, which is on haploscope-based pupillometer system, which is actually to look at the pupillary light reflex. This is look at the neural mechanisms, how the pupils react to the light and things. So this is completely been handled by the Erasmus team, and the master students who were working on the eye movement perimetry, they took a PhD on this. So eye movement perimetry, there was one PhD candidate who had completed her PhD in the eye movement technology, and she recently graduated. And the other student is working on this particular pupillary light reflex, and this is her PhD topic now. So the final product, the idea of eye movement is not only with glaucoma now, they are actually looking at the pupillary measurements and things. So the idea, which was a small discussion, which actually came out into a different product altogether. So this was not into the glaucoma diagnostics earlier. Now it has been into the glaucoma diagnostics. So that's how all your ideas need to be tested, and every spark may actually come out as a very good product or very good breakthrough, right? So this is my kind suggestion to everybody. So whenever you see a patient, if you have some questions, write it down, so that you may have similar patients coming up, and you can actually utilize your findings or your clinical implications to next patient, or you can try something different and see whether what is working well, right? So all your ideas has to be grouped, and you can actually do something better. So what are the different challenges with research? Because it's nice or easy to talk about research, but we should know the reality, right? So we have multiple challenges with research. First of all is training. So we need to know to diagnose the conditions better, and we need to be equipped with the diagnosis or the diagnostics too. And the other thing is clinical load. You may be seeing about 20 to 25 patients in a day, and with that on top of it, you don't want to take up research, right? So you feel like, oh my God, let the day be over. So you don't want to focus much onto the clinical load. Next comes the research focus, because you may not be interested in the complete glaucoma research. Maybe you may be interested in visual fields, you may be interested in diagnostics, you may be interested in assessment itself, or otherwise the quality of life. So likewise, different research focus would be there for each person, and you need to know what is your area of interest, and you should start working on towards that. Okay, instead of I want to work on everything. So instead of that, it's better you focus on one particular arena and then go with that. And then next and the most important aspect is the funding, right? Not all the research would be, I mean, ideas can come out as complete research, because you may have a lock there saying that you don't have funds to go further. So you should be knowing where to tap for funding. So I'm just going to give you some research sources where we can actually write grants and get the funding. So these are international agencies where they are actually exclusively working on glaucoma research. Okay. The National Institute is one common forum where you can apply for grants, and the other three are exclusively for glaucoma. That is the Bright Focus Foundation, and then the Glaucoma Research Foundation. The Bright Focus Foundation is from National Glaucoma Research, and then the Glaucoma Foundation, that is also for exclusively glaucoma-based research. It's not only clinical studies, you can actually have clinical with a combination of different arenas which we had discussed. It can be epidemiological, or it can even be a basic science research, or it can be technology testing, diagnostic tool development. Anything can be written there, and you can, if your writing skills are good, then definitely you should try for writing the grants. And the other national grant schemes are the Department of Health Research, that is the Ministry of Health and Welfare. So you have a grant in aid scheme where you can start writing a short proposal and you can start working on it. So it's going to give you a seed money where you can start your ideas and see whether the idea is workable or not, and then start writing for bigger grants. The other ones are the DST, the Department of Science and Technology, or the Department of Biotechnology. So the idea of eye tracking technology we said was actually a DBT funded project. Okay. And we also had multiple other population-based studies which were conducted simultaneously. The National Eye Institute funded project was there, which is like US and India collaborative projects, mainly for genetics. And all these projects came in because we had few ideas coming up and we started publishing. So once you have multiple publications from your end, people will start reading it, and people will also know what is your area of research. And then if it is going to be a mutual common interest, then they would approach and we can start working towards that. Okay. So I was telling you about a breakthrough which happened. So that is the grant from the Glaucoma Foundation Research, which is from the US. So evaluating the effect of ocular UV. So I told you that my PhD was on UV exposure, but I was continuously working with the glaucoma research team. So I was looking at the exfoliation syndrome in the Indian population and was looking at the environmental effect, like exposure to UV, was it a causative factor or not? So this was a grant which was written down for the Glaucoma Foundation, and it was funded. So an international grant was there in my hand. So that was actually a breakthrough, because I started with a small visual field testing study, and then got into the epidemiological studies, started supervising students for master's project and the bachelor's project, and now I have my independent research grant where I have my research fellows working for the grant. So it is the transition from a student to a researcher, and then a supervisor, and then coming out as a independent researcher was the journey, which I actually is not a one day's dream coming out. Okay, it is actually a hard work. So I feel that as an optometrist, if you are interested in research, there is always a way. So focus towards that, and you will definitely be able to reach your goal in some time. Thank you so much. I'm done with my presentation. So if any questions, we can actually have some discussions here.
Thank you so much, Dr. Rashima, for sharing your research journey and writing grants and getting. So thank you so much, Dr. Rashima, for covering that. Free to post it here in the chat. So, Rashima, can you hear me?
Yeah, the voice is breaking.
Yeah, I think
now it's better.
Yeah, I think there's some internet issue from my side. I'm sorry.
So is there any questions on the chat box?
There is no question at this stage, Rashima, in the chat box.
Mhm.
Can you hear me?
Kalpa, your voice is feeble. Hi, Kalpa.
Rashima, can you hear me? I think my internet is very weak here.
Now I can hear you.
Yeah, you can hear me? Okay.
Yeah.
Okay. Rashma, at this stage, we don't have any question. Okay, there is one question here. How to rule out block rural eye camps?
How to?
How to rule out glaucoma in rural eye camps?
Okay. So I saw the chat question. Thanks, Mr. Muhammad Rasa. This is an interesting question. So you need to have rural camp. Whenever you have rural camps, make sure that you take a proper history where you take in questions about mainly the risk factors for glaucoma. That is the any injury or any steroid usage or any say family history. So all these risk factors has to be elicited, and then look at the vision. And if you feel you have to do a slit lamp examination, because torchlight alone is not going to be helpful. But yeah, I know that using a torchlight, you would be like you do a shadow test and look for the Van Herk grading. But I would prefer that you look for a slit lamp, handheld slit lamp. So where nowadays you even have a mobile based slit lamp which is coming up, so you can actually hold that for the camps, where you can look into the anterior examination, look for anterior segment, anterior chamber depth, look at the lenticular status, and then look at the posterior segment using the fundus cameras or diachrome. Direct ophthalmoscope. So when you look into the disc, you get to know whether the person is actually having a healthy disc or not. If you're if you have a potential to have a non-contact tonometer, then it is good enough to have a non-contact tonometers to look into the intraocular pressures, because FT is not going to be very helpful in screening for glaucoma. Okay. So look at the optic nerve health. If it is going to be a good, healthy disc, then you are safe. So you are actually safeguarding the person because there is no structural damage which is happening. If you have a risk factor from the history, they say that there is a family history, and you're seeing a cup to disc of 0.5, and there is a asymmetry between the cup to disc ratio of about 0.2, then there is a chance that the person is going to have a high risk for glaucoma. Then you start referring the person to for glaucoma evaluation. So when you ask me what are the mandatory things, I would say a proper history taking, a proper fundus evaluation, and slit lamp evaluation is important for glaucoma diagnosis in a rural camp. Thank you.
Thank you, Rashma. And there is one more question, which is
Is there
about
any scope?
grant writing. Will it be possible to share few tips for writing a research grant?
Okay, right. Okay, whenever we start writing a grant, you should be having a solid research question and some amount of pilot work which is being done from your end. Say I may have an interest, say I want to know whether yellowing of lens is because of UV radiation or not. Okay, that is an interesting question, but I should have done some groundwork showing that that is my passion and I want to do something more into it. Okay, so all your um, research grants should have some questions which also is supported by some pilot study works from your end. So if you ask me, the TGF grant actually came in because of the publication of pseudo exfoliation and also the publication of UV. So I had a strong support or a background stating that I have some work which is being done with UV exposure and some work which is being done for pseudo exfoliation. So I'm capable of diagnosing the condition. I'm capable of doing this research. So the funding agency should get convinced from your grant proposal. Okay, so unless and until you have a strong supporting evidence, nobody is going to give it to you because it's all competitive, right? So who gives a nice platter, they gets the chance first. Okay, so I would say that if you have good ideas, start working at least in small pockets. Just start exploring. It's okay to start have a seed money from um, don't go for a national grants first. Look at something which is like somebody is supporting for the research work and things. So locally, if you could get someone to support for your ideas, it would be good. Okay, then write for the international grants. Don't write straight away, go for the international grants is my suggestion. And there may be people who are very successful in getting the international grants in the first plot itself, but my suggestion is to start having some publications to your end with say a case report or something like that, saying that I have interest and I have been working for this interest for such a long period. So it is necessary that I need a support. So why don't you support? It should be like that when you write a grant.
Thank you, Dr. Rashima.
Okay.
And there is one more question here, which says, is there any scope for optometrists in the industries regarding glaucoma?
Okay, probably I've been okay. Probably I've been into the occupational optometry and glaucoma. So this question to me, I believe. Yes, whenever we go for occupational optometry screening in industries, we screen for glaucoma. And you won't believe that many of the patients or the employees of the industries, they got screened for the glaucoma for the first time. And I should say they're so much grateful to us because we have diagnosed it at the early stage itself and we have referred to the ophthalmologist and they are into the glaucoma care at the right time. Okay, so going to industries and screening for glaucoma. The screening for glaucoma is the same as what I said for the rural eye camp. It's going to be anterior examination, posterior examination, and intraocular pressure assessment. If you find anybody at risk or any borderline intraocular pressures or structural damage is being present, refer them for the ophthalmologist who can actually take care for glaucoma. Okay, so if you put them in this right, safe hands, then the person is going to be taken care well. So it's only by diagnosing and referring at the appropriate.
Thank you, Rashima. And one more connected to the grants. So can I apply for grants from Glaucoma Research Foundation for an ongoing PhD research in glaucoma?
Yes, you can actually submit proposals to the Glaucoma Foundation. Whether it is going to be like partly funded or not, you can actually provide that also as an evidence. Like this has been ongoing for so many years and this particular work has been completed. So as I said before, you show the completed part of your PhD as a supporting evidence, and then whatever has to be forthcoming, whatever objectives you want to test it after that can be submitted as a proposal. But remember, they take about 6 months to review your proposal and send back. So that timeline also should be kept in mind. Okay.
Okay. Thank you, Dr. Rashima. There is one question, Rashima. Are there any specific grants for cornea or anterior segment disorders?
There should be something on cornea. I've been working exclusively on glaucoma, not looked into it, but definitely national grants are available, and NEI also supports for blinding diseases. So it is available. So exclusively for cornea, I'm not sure of.
Okay, thank you. Another question, should a review article be written only when we get an invite from the journal?
No,
or
not at all. Not at all. So even, see, somebody was asking a question that they are actually in the process of PhD, right? So which means they would have done an extensive literature review. And if something, there is something new you have found and you feel that this collation of literature can actually go into a publication, then you can actually write that as a review. You can definitely do it. So it need not be as a invitation. It can be written as a review paper from your end.
Okay. Thank you, Dr. Rashima. And is there any kind of a review that you would suggest for the beginners to start with?
Okay, so that's what I said. When you start working on some area of research, like I would say, you started reading about different visual field strategies, okay, like different visual field diagnostic tools, and you want to know which one is the best and things, you can actually look into the papers which has written down about. For example, I compared eye movement perimetry and visual fields, Humphrey visual field, right? So likewise, there could be some other visual field techniques which are available. So you want to know which is the current updated knowledge and things, you can write a review about it. So likewise, whatever is your area of interest, you have read so many papers into that, then start writing with that. So that would be the best start. And for all people who are into the PhD or in the verge of completing masters, I would suggest start writing a review so that you would have a better or in-depth understanding about whatever field you're working on.
Thank you, Dr. Rashima. So yeah, there is a lot of, I mean, even we have messages from the participants here thanking the wonderful for sharing the wonderful research work that you and your team are doing here. So we are coming to the end of today's session. Thank you again, Dr. Rashima, for sharing the research journey. Yes.
Before you end, I just wanted to have one update here.
Yes.
I should thank Kalpa, because Kalpa is one person who was with us in our team, and she was working on the eye movement technology also with us. She's now moved to IVI, but she has also extensively worked with us for the eye movement technology. And thank you so much for all your knowledge sharing and your efforts with us.
Thank you, Rashima. And it was wonderful working with you all. And Rashima is my glaucoma guru, I would say. And Rashima is one of the best optometrists in the country who has worked extensively on this topic, glaucoma, which is again very, very important one. And thank you, Rashima.
Thank you so much. Thank you for all the time.
And we also have messages from the participants here. Thank you for the wonderful session and being an inspirational one for a budding researcher. Thank you, Rashima.
Thank you so much. Yeah. Bye.
And thank you all for joining today's talk on IVI's Excellence in Vision Science lecture series and making the session very interactive. This session was really very informative, and glaucoma again is a very important topic. And thank you, Rashima, for sharing your research works that you are doing. It's best wishes to your entire research team for the excellent work that you are all doing.
Thank you. Thank you so much for inviting me too. I really enjoyed the session.
Thank you, Dr. Ashima, and thank you, everyone. So our next session of Excellence in Vision Science lecture series will be in April. And so stay tuned to IBI's social media platform for further details of our upcoming sessions. Thank you, Dr. Ashima, and thank you, everyone, again. Have a nice evening. Bye, everyone.